Hi, how are you today?
Good, how are you?
Good. My name is Christina and I will be your nurse today.
Okay.
Okay, can you tell me your name and date of birth?
Alyssa Hubbard, June 7th, 2000.
Okay, Alyssa, and can I see your armband? Okay, great. We are going to close the curtain. Alyssa, we are going to be doing a head to toe assessment on you today. Okay, we're going to raise the bed. We're going to drop the gait. At the same time, we are going to be looking at Alyssa, looks the age, stated she does not seem to be in distress. She does not appear to be using any illegal substances. Alyssa's dress is appropriate for the weather. Alyssa is well kept. Alyssa's demeanor is appropriate for the situation, and she seems to be cooperating. Alyssa does not have any mobility devices next to the bed and seems to be sitting upward, and her proportions are equal throughout her whole body. Okay, so now that we have raised the bed and dropped the thing, Alyssa, we are going to start with the, can you tell me who the president is?
Donald Trump.
Okay, and can you tell me where you are?
The hospital.
Okay, so Alyssa's LOC, or level of consciousness, is LOC times 4. Alyssa, are you in any pain?
No.
Okay, so Alyssa states that she is not in any pain. We will not go any further with the pain assessment. Alyssa, we are going to start with the cranial nerves, okay? So the first cranial nerve is the olfactory, so I'm going to have you plug one nose and smell, and plug the other side and smell. Are the smells equal?
Mm-hmm.
Okay, so cranial nerve 1 is intact. And now for cranial nerve 2, I'm going to have you read from the Snellen chart that is 20 feet away. Can you read with covering one eye?
EFPTOZ.
Okay, and cover the other eye and read it in reverse.
ZOTPFE.
Okay, so Alyssa's cranial nerve 2 is intact, and her Snellen chart ended up being 20/20. For cranial number 3, 4, and 6, we are going to be looking at Alyssa's eyes. Alyssa's pupils are about a 4. They are equal in her eye. Okay, and Alyssa, okay. And Alyssa's eyes do constrict with light. Now I'm going to have you look at this and follow it towards. And Alyssa's eyes do accommodate. And if you could follow this. Okay, Alyssa is able to follow. And so she is able to actually accommodate the cardinal 6. Alyssa, we are going to move on to cranial nerve 5. Okay, so I'm going to have you bend down, clench your teeth. Yep. Okay, there you go. And then can you tell me, can you feel this?
Yes.
Okay, so cranial nerve 5 is intact. Cranial nerve 7 is your facial cranial. So I'm going to have you puff out your cheeks, okay, and smile and frown and raise your eyebrows and close your eyes as tight as you can. Okay, so cranial nerve 7 is intact. All of her facial features are symmetric. And the next one that we are going to test is cranial nerve number 8, which is the whisper test.
1, 2, 3.
Okay, so cranial nerve 8 is intact. Cranial nerve number 9 is the gag reflex. So I am going to see, can you open your mouth? Okay, so she has the gag reflex. Number 10, so that's cranial nerve number 9. Cranial nerve 2 is, I'm going to look at your uvula and stick out your tongue. And your uvula is center and midline. Okay, and can you swallow for me? Okay, so cranial 10 is intact. I'm going to have you do cranial nerve number 11. So you're going to shrug your shoulders up, okay, and turn your head side to side. Okay, that's cranial nerve number 11, which is intact. Cranial nerve number 12, you're gonna stick out your tongue. Okay, and now you can stick it back in, and you can say light, tight, dynamite.
Light, tight, dynamite.
Okay, so that's cranial nerve number 12. So Alyssa has passed all the cranial nerves. We are now going to move on to her head. Alyssa's hair is exactly how it should be. It is dispersed evenly throughout her head. There are no patches. There are no lesions. There are no abnormalities. I'm going to palpate, and there is no masses in her head. That's good. We're going to look in your eyes, okay? So her sclera is white in both eyes, and her conjunctiva is pink and moist. Now I'm going to look into your nares, and her nares are equal, and her septum is midline, and her nares are pink and moist. And now I'm going to go to your ears, and there is no drainage in either ear. Now we're going to palpate your ears. Okay, does that hurt?
Yeah.
Okay, that's good. So and then we're going to look at the oral mucosa in your mouth. Can you open up? Okay, so that is pink and moist. Okay, and your trachea is midline. That is good. I'm going to have you actually, we're going to move to 30-degree angle. Okay, so there you go. And just don't go back. Just lay there. Okay, there you go. Put your head back a little bit. There you go. And so now we're going to look for jugular vein distension. And there is no jugular vein distension in her neck. We're going to palpate her carotid arteries. Her carotid arteries are good and strong. I would say they are a 3. The rhythm is even. Okay. And now I'm going to listen for brutes. Okay, there are no brutes in her carotid arteries. Now I'm going to feel for your lymph nodes. You can put your head up. And I'm going to feel for lymph nodes. Okay. And that's not swollen. And your thyroid. Oh, yeah, that's good. It's really good. Okay, and so now we're going to move on to your upper extremities. We're going to look at your arms. Your tone is even on both of your arms. Your tattoos seem to have healed nicely. There's no infection or anything like that. All skin is intact. There is no edema. The proportions of your joints are equal. They are in line. And now we are going to see, tell me if you can feel this. Can you feel that? Can you feel that?
Yes.
Okay. Her capillary refill. Okay. Is less than 3 seconds. Now I'm going to feel your radial pulse for 30 seconds. Okay, so your right radial pulse is even. It's a 3, smooth and even, and it is 70. Okay, and now we will check the left radial pulse. And Your left radial pulse is even and steady. It's a 3, it's a +3, and it is also 70. Okay, I'm gonna have you grab my hands and squeeze, and now pull, pull. Okay, and now push. Okay, Alyssa's range of motion on her arms is a 5, is a +5. So, Alyssa, do you have any chest, jaw, or shoulder pain? Okay, we're going to go ahead and check your cardiac system. Okay?
Okay.
Do you have any shortness of breath? Okay. So this is the aortic and the pulmonary and the Erb's point and the bicuspid, and over here is your mitral valve and your radial, and I'm going to count that for 1 minute. Okay, that is also 70. Okay, I'm now going to check your respiratory. Okay, so I'm going to have you sit up just a little bit better. Okay, and I want you to, every time my stethoscope touches your skin, if you could take a breath in with your mouth open. Okay, that'll help me hear it better. And breathe. And breathe. And breathe. And breathe. And breathe. And breathe. Wait, hold on. Okay. So that is clear and no advantageous sounds. Now I'm going to do your back. If you can breathe. Breathe. And breathe. Breathe. Okay. And we're just going to go over here. 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 Okay. Your lungs are clear. There's no advantageous sound, crackling, wheezing, stridor, or rhonchi. Okay. So now we're going to look at your abdomen, and I'm going to look at your thorax, and your thorax seems to be in color with the rest of your body. Temperature is warm like the rest of your body. Okay. And you have no tinting, so you're not dehydrated. Okay. Now I'm going to look at, and now I'm going to look at, all of that is distributed well. Okay. So now I'm going to look at your abdomen. Okay.
Okay.
And that looks good. I'm going to listen to your abdomen. Have you, when was your last bowel movement?
Couple days ago.
A couple days ago. Is that typical for you
Yes.
to have it every couple days? And was the color, how was the color?
Normal.
Normal, okay. And the consistency?
Normal.
Okay. And how about urine? How's your urine?
Normal.
Does it smell, have an odor, does it burn, anything like that?
No.
Okay, okay. Just want to make sure. There is no hernias around her umbilicus. Okay. And there is no brutes with her aortic. Okay. And now we're going to palpate. And there's no hyperresonance or any dull sounds, okay? Now if you could sit up, I'm going to check your kidneys. Okay. Does that hurt?
No.
Okay. You can sit back. Okay. And now we are going to do your legs. Your legs seem to be, color is good, it's consistent, the joints are in the same area, that looks good. Hair seems to be distributed, tone is even in the legs, okay. The proportions, they are equal on your legs, okay? Can you feel this?
Yes.
And can you feel this?
Yes.
And are they the same?
Yes.
Okay, okay, so, and the temperature on her legs is warm like the rest of her body. And now we are going to check your popliteal pulses, which is underneath your knees. And sometimes they're kind of hard. There we go. So the popliteal pulses has a normal rhythm and they are a +3. And then we are going to do the posterior tibialis pulse, which is here. Okay, and that has a normal rhythm as well. And that is a +3. And now we're going to look at the dorsal tibialis and let's see those. Okay, those pulses are good. They're +3. Can you pull my hands towards you? Okay, and can you push? Okay, that's good. That's good. I'm now going to lower the bed. Okay, Alyssa. Yeah, Alyssa, I'm going to have you come this way. I'm noticing that Alyssa does not need help moving. Are you dizzy or anything? Okay, that's great. Are you weak anywhere?
No.
Okay. Can you put your feet together and your hands here and close your eyes? Okay. Alyssa did pass the Romberg test. If you could bend over so I can look at your spine. Alyssa's spine is straight. There's no curvatures, anything like that. That is wonderful. Thank you. Yeah, there's no scoliosis back there. And if we can have you walk that direction for me and walk back heel to toe. Okay. So I'm noting that Alyssa's movements are smooth, steady, and coordinated. Okay, we are done with our assessment today. So I'm going to put you back in bed and I'm going to raise the rail. Okay, make sure that the bed is in the low position. And do you need anything before I go?
No.
Okay, and the call light is right over there for you. Okay, so you just call me if you need anything, okay?